Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. So, my dear friends, these lectures, especially of today's lecture, is related with Prasuti Tantra and striroga Vijnana of the third BMS. Although it is very useful for the BMS students, but it is useful for the doctors, professors, as well as even common man. Yes, because we are discussing the feminine or gynecological problems. This topic is related with the paper 2. You must know that there are two papers. Paper 1 is obstetrics, that is a pregnancy, delivery, post-delivery, puerperial period, all these things are there. And in the second paper, that is a striroga, we have the important 15 points in paper 2. Can you just listen those carefully? I am discussing the very important topics. For example, Stri Sharira Vijnana is like anatomy and physiology, especially anatomy. Stri Sharira Vijnana. Then Stri Sharira Kriya. Kriya is a physiological part. That is a menstrual cycle, Raja Pravruti, etc. Then Rajo Vikar. Raja Vikar. That is a different menstrual problems. Fourth, maybe Shukra Vichara, related with the Shukra Dhatu in our body. Then there are Kashtartava, dysmenorrhea, Rakta Pradara, heavy menstruation, Yoni Vyapad. In Charaka Samhita Chikitsa Sthan, chapter number 30, 20 most important gynecological problems or problems related with the female are mentioned, and that all together the group of those problems is called in Ayurveda Yoni Vyapad. Diseases related with the female reproductive system, related with the female genitals. That we are continuing with the third part, but afterwards in the paper 2, there is also Yoni Kanda, Yoni Arsha, Niruddha Yoni, Garbhashaya Arbud, Rakta Gulma, Stri Vandhyatva, that is infertility. My dear friends, infertility in women, this video is best video that I have already uploaded on my channel. You kindly check the Stri Prasuti Tantra classes. You will get gynecological videos, all the videos, and in that video is an infertility video, very interesting video, simple language, causes, symptoms, treatment, everything I have mentioned. So please check, search infertility, Professor Dr. R. Deshpande. You will get that video. Then Rakta, for example, Stanaroga, that is related with the breast problems, and Sthanika Chikitsa like douche and the Yoni Dhavana, Uttarabasti, etc. So my dear friends, today we will continue the third part of Yoni Vyapad. This may be the last part. Please check the previous two videos because we are covered all the 20 points, and these points are useful for the practice. These points are also related with your Charaka Samhita Uttarardha. So Charaka Samhita Uttarardha, chapter number 30, Yoni Vyapad, that we may escape because already we have discussed. I will just quote. So kindly open your notebook. 20th February, write down Yoni Vyapad part 3. This is minimum. Okay. And I will tell the 20 names. Repeatedly hear those names. Vataja Yoni Vyapad, Pittaja Yoni Vyapad, Kaphaja Yoni Vyapad, and Sannipatik Yoni. First 4 are very easy. 3 doshas and Sannipatik, all the 3 doshas. Then Asruja, Arajaska, Acharana, Aticharana, Prakacharana. Today we are going to see further Upapluta, Yoni Vyapad, Paripluta, Udavarta, Suchimukhi, Antarmukhi, Karnini, Yoni Vyapad, Shushka Yoni Vyapad, Vamini Yoni Vyapad, Putragni Yoni Vyapad, Shandi Yoni Vyapad, and Mahayoni Yoni Vyapad. So let us start with the Upapluta Yoni Vyapad. For you, I will mark that particular portion. We will concentrate only on Charaka. And very important thing. For example, Upapluta is related with the Kapha. Write down K capital. Kapha Kar Ahar and Kapha Kar Vihar. You know, understand what I mean. High calorie food, high fatty food, which is very difficult to digest. All the times eating sweets. मिठाई बोलते हैं हिंदी में, मिठाई ज्यादा खाते हैं लोग, ओवर ईटिंग करते हैं. सो ऑल दिस प्रॉब्लम्स आर कफर. देन सेडेंटरी लाइफस्टाइल, कुछ भी एक्सरसाइज नहीं करना, सेडेंटरी, बैठे बैठे रहना, कंप्यूटर के सामने बैठना, टेलीविजन के सामने बैठना, पूरा 24 घंटे में से 8-10 घंटे बैठा ही रहना. So that is called as a kafakar ahar and kafakar vihar. No exercises at all. Madhur amla and lavana rasa in excess. Madhur amla lavana rasa taste in excess. Then also air conditioning, all the time sitting in the air condition, always taking the cold drinks, freezed substances. So all, then pizza, burger, cheese especially, very very bad kafakara. So what is happening? There is a vata and kapha because each and every yoni vyapat, there is involvement of vata dosha. Vata drute nasti yoni vyapadaha. Without vata, no gynecological problems can take place. So vata is there, but here kapha is also there. What is the lakshanas? For example, here only important thing you write down strava. As kapha is there, so pandu, whitish color, sticky straw will be there, and vata is there, so little bit pain will be also there. So kapha and vata. Now we will see the chikitsa. Yoni prakshalana, bush washing with siddha taila prepared from boiling tila taila with jivaniya dravya. Jivaka, Rishabhaka, Meda, Mahameda, Kakoli, Kshirakakoli, Mudgaparni, Mashaparni, Jivanti, Madhuka. Madhuka is a Jeshtha Madha, licorice. This Jivaniya Gana is mentioned in Charaka Sutra Sthan, 50 Mahakashaya. So this is called as a rasayan for that female reproductive system. Then as there is a vata, so you can do snehana and svedana. Then as there is a kapha, you can do vamana, but soft type of vamana, followed by pichu dharana. Pichu means swab with santarpana tail, because vata is there. Try to understand. So santarpana oil is used. According to Sushrut, this particular type has not been mentioned. According to the Vagbhat, this is having again vata and kapha, but pichila and raktastrava. Can you see here? I will mark for you. This is here. Can you see pichila? Stickiness will be there. Now, what is this? Whenever we see white, sticky, just now my student has mentioned, he has seen the case of white discharge. White discharge is called as a leukorrhea, Shweta Pradara. So this particular Upapluta is correlated with white discharge due to moniliasis. This is most important. Always try to remember correlation, comparison. Upapluta, kaphadosh, pitchil and whitish strava, sticky, then compared with the fungal infection, moniliasis. Upapluta, coincidence. My student just now was talking about white discharge. This is moniliasis. Remember this thing. Upapluta Yoni Vyapad. You can discuss with the teacher next time. Sir, this is related with the Upapluta? Oh, Sila. Okay. Good. Now we will go for further. That is Paripluta Yoni Vyapad. The name is Paripluta. Concentrate. Focus. This is Kshavathu and Udgar Vega Dharana during the copulation. During the intercourse, the lady, she is having and she has stop that forcefully, then that is a problem. Then if she has belching herbs, but she is not doing that because of the starting of the intercourse, doing the intercourse, then that Paripluta Yoni Vyapada type of problem starts. So this is Vega Vidharana problem. In Vagbhat or in Charak also, na vegan dharayet. These two lines you always remember. Deshpande sir has said many times. Na vegan dharayet, vat, wind, mutra, kshavatruchudam, nidra, kasa, shramashwas, jrumbha, shru, chardiretasam. You can write down this shloka afterwards in your notebook and then say 100 times. Na vegan dharayet, na vegan dharayet. Now I will make the list. Vat, vat, vit, mutra, vat, vit, mutra, kshavathu, kshudham, vat, vit, mutra, kshavatrutt, kshavatrutt, kshudham, nidra, kas, shrama, shwas, chardi, retasam. And here are the two waves. One is a kshavathu and second is a udgar. Next, this is the problem with the, again, what is there? Pitta problem is there because irritation will start. Nervous, nerve control, nerves, they will be get irritated because this is a reflex. According to the modern science, this is visceral reflex. And any reflex you forcefully stop, the nerves get irritation. That is pitta. Okay? So shofa will be there. Sparsha akshama, tenderness. Then raktastrava. Raktastrava, that is sa, arti, nila and pita varna. Then there will be vankshana and prishtha arti. Can you write down this arti? Arti is like a, what you can say, the uncomfortable feeling or pain. But as pitta is there, there may be some jwara also. Okay? So what to do? Pichu dharana. In every, nearly every Yoni Vyapad, there is a common, is a Yoni Prakshalana and Pichu dharana. You don't forget these words. Yoni Prakshalana. In any way you can write down. Yoni Prakshalana and Pichu dharana, swab. Taila, and always taila, medicated oil. Taila processed with kvath. What is that kvath? Shallaki, Jingini, Jambu, Nyagrodha, Udumbara. Only 1, 2, 3 you remember, other forget. Okay. Now, about the Acharya Sushrut, he has mentioned the involvement of Vata dosha, severe pain during the copulation. That is called as a dyspareunia. I am telling you about the Sushruta here. Can you see? Pain during the intercourse is called as a dyspareunia. According to Vagbhat, this is Vata Pitta. Again, there is a different type of strava. Okay. Then Kuti Gaurava, Atisar will be there. Loose motions also. So different Acharya has mentioned the different lakshanas. Okay. Correlation with the modern medicine. Can you see over here? I'm sorry. I will just take a screen over here. Just give me a few minutes. I will try to rectify that problem. Okay. Anyway. There is a problem of the screen, but anyway, here you can see dyspareunia. That particular condition, what we have seen is a painful intercourse. As per Sushrut, Charak description indicates acute gonococcal infection which can be developed into the PID. Write down this word, pelvic inflammatory disease. PID, pelvic inflammatory disease, because all the time there is pain and also burning. So acute gonococcal infection with PID. Okay. Now next is a Vipluta Yoni Vyapad. Can you see here? Vipluta Yoni Vyapad. Can you see Nidana? Mithya Viharu. Your lifestyle may be wrong. At what time you are waking, what time you are doing the exercises, everything will be wrong. That is called as a Mithya Vyavahar. I can give you some examples also. We will try to find out some examples of Vipluta Yoni Vyapada. So please write down Vipluta Yoni Vyapada. Vipluta Yoni Vyapada, which is related with the different types of the misconduct during the whole day, because this is not mentioned by everybody, especially Charak is not mentioned. He has mentioned under the Chikitsa of this particular Vipluta in the Paripluta itself. According to Acharya Charak, mentioned only under Chikitsa instead of the Paripluta. Okay, so Vipluta is not mentioned directly as such by the Charak. This point you must note it, that Vipluta Yoni Vyapad is not mentioned by Charak separately. Then Sushrut has mentioned that, and he has said it is related with the Vata Lakshanas and Nitya Vedana, daily or continuous vaginal pain, because it is Vata. Then according to Vagbhat, Vipluta Yoni Vyapad referred to the Acharana Yoni Vyapad. So he has made the comparison with the Acharana Yoni Vyapad. Now, comparison with the modern relation, because it is only Vata, here you can say the neuralgia, nerve pain. Neuralgia is a nerve pain. It may be psychogenic in origin or may be chronic pelvic pain or dyspareunia. So any type of the pain you can say as a Vipluta Yoni Vyapad, but not mentioned by Charak separately. Okay. Now we will go further. That is Udavartini Yoni Vyapad. Just please write down the title, Udavartini Yoni Vyapad. Udavartini Yoni Vyapad. The main cause is like previous one, Vegadharana. But here Vegadharana of Vata, gas passing to the rectum, Vit, that is stool. If you are want to go to the what you can say the defecation, the patient is forcefully stopping that because of some occupied his other activities. So that is wrong. And even whenever you get the feeling of urination, the person should go for the urination. But if you suppress the defecation and urination, then Udavartini means reverse, anti, normal peristaltic, anti-peristalsis. That is Udavarta. In Ayurveda, Udavarta Vyadhi has also been described, especially mentioning the anti-peristaltic movements in the intestine, Udavarta. Okay. So this is another reason is Pradushta Artava. Your menstrual, what you can say, the discharge may be having some infection, and also sometimes it is related with hormonal problems. So according to Charak, Udavartana Yoni Vyapad, dosh is a Vata, and whenever there is a Vata, there is always pain, Ruja, Trichra Rajastrava, that is dysmenorrhea. Please write down dysmenorrhea. Pain gets relieved after the discharge of menstrual blood. That is called as a premenstrual syndrome, PMS, premenstrual syndrome. This is very important. Then Chikitsa, as this is Vata, so most important is the Sneha Pana, that giving the Siddha Ghrita or Siddha Taila. Basically, medicated ghee can be used like Trivrut, Nishottara Ghrita, which will make the normal Apana Vayu Anuloma Gati. Anuloma Gati is more important. Whenever there is a Udavarta, reverse, you have to give the Anuloma Gati by Snehan and Svedana and by medicated ghee. So Snehan, Svedan, Basti. Whenever there is a Vata, always write down the Basti with Kshira, medicated milk, boiled with adding Dashamula, Bruhat Panchamula and Laghu Panchamula. Dashamula, 10 roots, are most important analgesic in Ayurveda. Write down, most important. In the market, you can get Dashamula Rishta. Dashamula Rishta is the best medicine in Ayurveda to relieve any type of the pain, especially musculoskeletal pain and neurological pains can be controlled by group of 10 roots, Dashamula Rishta, 4 TSF with equal amount of water. So here we are giving the Basti with Dashamula. So 10 roots, you must always remember that is a Dravya Guna subject, but don't forget this, the Bruhata Panchamula and Laghu Panchamula. Bilva, Agnimantha, Shonak, Patla, 10 to बिल्व अग्निमंथ, बिल्व अग्निमंथ, शोन्नाक पाटला 10-2, लघुपंचमूळ, शालिपर्णी, पृष्णिपर्णी, बृहती, कंटकारी, गोक्षुर. शालिपर्णी, पृष्णिपर्णी, बृहती, कंटकारी, गोक्षुर. टुगेदर बृहत्त पंचमूल, लघु पंचमूल, दशमूल. Best analgesic in Ayurveda, which will relieve the pain, arthritis pain, neurological pain, musculoskeletal pain, backache, cervical spondylosis, anything, lumbar spondylosis. Okay. Then there is Anuvasana Basti, only oil, and also you can give sometimes Niruha Basti. Yoni Prakshalana, with again medicated ghee, especially taila is used for the, or pichu can be used for this purpose. Now, Udavarta, according to the Sushrut, here you can see, he has also mentioned about the Vata. So, Vatala Lakshana, Vatala, that is predominantly Vata imbalance is there. So, Raja, Safena, bubbles, Safena like a bubbles, Krichra Strav, Krichra difficult. You remember the word Mutra Krichra? Mutra Krichra. That is, yes, dysuria. But here, Krichra menstrual cycle, that is a dysmenorrhea. Please write down, dysmenorrhea. Okay. According to the Vagbhat, Udavarta Yoni Vyapad, again with the Vata, Fenil Raja and Krichra, same. Sushruta and Vagbhat, same. Now, clinically, modern medicine, you can see this particular description and relief of the pain at the onset of menstrual flow is suggestive of primary dysmenorrhea. This modern correlation, you always remember, try to write down those things. Primary dysmenorrhea, it also correlated to premenstrual syndrome. Premenstrual syndrome, PMS. Why I am saying that? Because there will be edema 6 days before, 1 week before the menstrual cycle. The lady will complain, you doctor, I am getting this, my bangan little bit tight, my blouse is little bit tight, and only these days, then I feel heaviness in the body. I have the pedal edema. I am feeling little bit nauseating. But when the first day and bleeding starts, automatically the symptoms go off. Automatic. So that is premenstrual syndrome. Syndrome is a group of symptoms. We will go further. The next Yoni Vyapad, please write down the name, Karnini Yoni Vyapad. Karnini, please write down. Just a moment, I will mark for you. Concentrate. Karnini Yoni Vyapad. Karnini Yoni Vyapad. Okay? Charak Chikitsa Sthan, chapter number 30. That is, Vat and Kapha is there, but here the Nidan. Cause is important. Mithya Vihar and Pradushta Artava. Fortunately, I have Charak with me. So, just as a, what you can say, the interesting thing, I would like to say the shlok of that Karnini Yoni Vyapad. Charak Chikitsa Sthan, chapter number 30. Please write down the reference. Shlok number 27. Akale, Vah Manaya Garbhen. Akale, Vah Manaya Garbhen. Pihito Anilaha. Anila is a Vata dosh. Karnikam Janayet Yono. Shleshma Rakten Murchitaha. Rakta Margavarodhinya. Sa Taya Karnini Mata. So, try to understand the meaning, that is a pathogenesis. Whenever there is a prasav avastha, delivery is taking place, especially prajanaishyaman avastha, and whenever there is a fetal delivery, that apatya patha is happening, then if there is no dilatation, if there is no dilatation and the lady is giving the force, pravahana, dilatation is not there, but she is making the force, then that apatya patha gets the pressure. That apatya patha, that marga, during the delivery, it gets the pressure, and apana vayu becomes pratiloma. Apana vayu, because of the obstruction, pratiloma, and that will sammurchita with rakta and kapha. Rakta and kapha, and then in Dvitiya avarta, at the second part of the uterus, there will be edema. And that edema is look like this shape, karnikakar. That is why the Yoni Vyapad is karnika. The edema will take the shape of ear. Edema will take the shape of the ear, and garbha nishkramana is a problem. Garbha nishkramana is a problem. So this is about the delivery. But sometimes even during the intercourse, if the lady is giving some force, pravahana, or akali vyavaya, that means premature type of the activity, sexual activity, that also creates the edema locally in the genital part, and that is why that is called as a karnini yoni vyapad. So what are the dosha? Vata and kapha. Nidana, pregnant woman strains prematurely to expel the fetus. Lakshana, Vata and Kapha vitiated rakta. Aggravated vayu gives rise to the karnika, that is sprouts of muscle or the nodular growth, and this obstructs the blood flow. Chikitsa, Yoni Prakshalana, always you write down Yoni Prakshalana, Pichudharan, okay, with Siddha Taila, prepared by boiling Tila Taila, sesame oil, with all the time Jivaniya Dravyas, Jivaka, Rushaka, Mahameda, Kakoli, Kshirakakoli, Mudgaparani, Mashaparani, Jivanti, and Madhuka. All you have to write down. Then Yoni Varti. Next important is Yoni Varti with Kushta, Pippali, Arka, Saindhava Lavana, and Ajamutra. And also you have to give the Kapha Hara Chikitsa or Kapha Ghna Chikitsa. Okay. According to Sushruta, Karnini Yoni Vyapad, because it is edema, Sushruta is saying it is a Kapha related. Then Shleshmika Lakshana, Kaphaja symptoms will be there. Karnikakar, Yoni, then blood in the vagina will be there. According to the Vagbhat, it is Vata Kapha, Karnikakar, Roga Marga, Nirodha, obstruction will be there. And modern medicine, you can see here, there is a characteristic development of Karnika, that is rounded protuberance in cervix part. It can be correlated with cervical erosion. Cervical erosion. Okay, we will go further. That is Putragni Yoni Vyapad. Putragni. So what are the things? Vatakar Ahar and Vihar, Pradushta Artava, Bija Dosh, genetical problem, and Daiva, that is your bad luck. Daiva is nothing but the bad luck. So according to Charaka, Putragni Yoni Vyapad, Dosh is Vata, aggravated Vayu due to the extreme dryness. What are the properties of Vata dosha? Remember Kriya Sharir? Tatra ruksho lagushitaha. Tatra ruksho lagushitaha kharasukshmascharo nilaha. So dryness is one of the important feature of Vata dosha. That dryness destroys the each and every garbha produced by vitiated bija. So as the ovum is not physiological, then that is destroying the fetal development. Fetus is not growing well, he is dying. Okay. According to Sushruta, Putra Gni, Putra is a progeny, baby. Gni, destruction. Pitta dosh is there, and Pittaja Lakshanas are there. The woman retains the bij, that is Garbha, for some time and expels miscarriage and abortion. This is nothing but the miscarriage and abortion. Vagbhat is saying it is related with the Vata, and Vata Lakshana will be there. For example, here you can see Dushta Artava, okay, repeated death of the newborn child. And if you compare with the modern medicine, Putra Gni, according to Charak, this is miscarriage. I will wait. Please write down these things, very important. According to Sushrut, it is a stillbirth. Stillbirth. Okay. And Jatagni, that is Vagbhata, it is a neonatal death. After delivery, neonatal. In the newborn baby, it will be die. So these all the things that the lady cannot get a healthy progeny, that is the problem. That's why sometimes it is called as a bad luck. We will go with the next, that is Antarmukhi Yoni Vyapad. First, you write down the name Antarmukhi Yoni Vyapad. What is that? Mithya Vyavahar, Mithya Vihar. What is Vihar? Copulation, intercourse after heavy meal or in abnormal postures. Abnormal postures. So naturally, there will be Vata dosha problem because activities, because Vata dosha is related with the activities. So activity problem means Vata problem. Okay. Distortion of the Yoni Mukha, Asthi, Maus, Arti. Can you write down this word? Arti means Vedana, pain. Write down. Arti means Arati, Asvasthata in Sanskrit word or Marathi word, uneasiness. And due to the excessive pain, sexual intercourse become intolerable. That is also called as a dyspareunia. A very painful intercourse. Chikitsa, Upanah, that is a potis, because Vata problem is there, Snehan Svedan. So kalk of Yava, barley, Godhuma, wheat. Okay. Then Shatapushpa, like a fennel. Then Priyangu, Bala is a very famous plant, should be applied. Upanaha made with this paste, you can apply locally. According to Sushrut, it is that Antarmukhi has not been mentioned by Sushrut, and according to the Vagbhat, Antarmukhi Yoni Vyapad is again related with the Vata, and there will be what you can say the distortion and Tivra Ruja. Ruja is a pain. Correlation with the modern medicine. This is a structural problem in the uterus of the female. What is that structural problem? You write down this. Position is not proper. Usually it is bent forward and T-flex, but in these cases, there is a retroflexion on the back side. Uterine will be shifted on the back side. You can go to the Google and search for the image retroflexion or retroversion of the uterus. Retroflexion or retroversion of the uterus with severe pain in the lower abdomen. Of course, this is a structural deformity regarding the Antarmukha Yoni Vyapad. Let us go further. Suchi Mukhi Yoni Vyapad. Write down the title. Suchi, needle. Suchi Mukhi Yoni Vyapad. Very small hole. Vatakar Ahar and Vihar. Samanya Vishay Siddhanta. You have to write down Tatra Ruksho Lagushi Taha Karasukshpashtaro Nilaha. Eating all the time dry substances, not taking enough water. Hydration is not proper of the body. Then moving all the time in the sun and wind. So that will make your body more dry. Always working in the air condition. Lot of Katu, Tikta and Kashaya Rasatmak, all pungent and spicy. They will make you dry. Okay. So Suchimukhi Yoni Vyapad, Vata doshi is there. Due to the dryness, aggravated Vata, the genital organs of female fetus in the womb become narrow and remain narrow even when the girl is grown up. Genital. Chikitsa, again, it is a Vata problem. So Upanah potis, Poultice, potis with kalka of Yava, Godhuma, Shatapushpa, Bala, Priyangu, etc. According to Sushruta, this is a three-dosha problem, and then will be vagina will be very, very small or constricted. Vagbhat, it is also Vata, and he says narrow opening or passage. In the modern terminology, you can have the different correlations. Suchi is like a needle. Suchi is like a needle. Suchimukhi Yoni Vyapad can be correlated with pinhole, very small, pinhole os or vaginal stenosis. This pinhole os is a rare, very rare, congenital deformity from the birth, where the os is very narrow as the size of pin head. It is also known as stenosis of uterine cervix. In some cases, the endocervical canal may be completely closed. Srotorodh. A stenosis in any passage in the body that is narrower than it should be typically called as a pinhole. Vaginal stenosis. Vaginal stenosis is defined as a narrowing and shortening of the vagina. Vaginal stenosis can cause vagina to become less flexible because for the passage of shukra, passage of semen, passage of spermatozoa, or especially delivery process will be much more difficult. Even intercourse will be very difficult. Okay, so vagina become less flexible, dry, totally dry, and more fragile. Immediate bleeding will start. Little trauma, bleeding. That is fragile. Naturally, difficult, painful sexual activity and discomfort during the PV examination. When the doctor is doing PV, the patient will be say, "Oh, doctor, no, please don't do it." That is very painful and tenderness will be there. Vaginal stenosis can be result of even sometimes chemotherapy, cancer patients, or radiation therapy. It's a side effect of that particular chemotherapy or radiotherapy, and sometimes surgery in the pelvic area. That is a side effect of that surgery. It can also be made worse by the cancer chemotherapy treatment. Now, what to do in these cases? Simple thing, management. Medicine is not much useful. Medicines are not useful. Only you have to do some mini surgical procedure. Like for example, vaginal dilatation therapy. There are the dilators available. Different number of dilators. Next time when you go to your clinic and hospital, see this type of the dilator, how they look like. A long, slender steel rods are there. And they are with simple anesthetic techniques or simple procedure, slowly, first small number, then big, and that hole is becoming wider and wider. So this is called as a vaginal dilatation, is an option for preventing and treating the vaginal stenosis. Vaginal dilatation therapy is for what? Gentle stretch the vaginal walls over the extended period of time. It is not happening today you are doing the dilatation and second day it will be dilated. No. Even weeks, months will take place to get this vagina little bit flexible. Okay. Usually weeks or even month. Vaginal stenosis often results in increased dryness in the vagina. So using a dedicated vaginal moisturizer, lubricants would help to increase the hydration. Using a heat pack can also reduce the discomfort from the pain. So, my dear friends, this is nearly the end of our different Yoni Vyapad. In this class, at the last, I would like to revise. 20 Yoni Vyapad, but with the modern treatment. I'm sorry, not modern treatment, modern medicines that are available of Ayurveda today. So let us make a fast revision. Number one, I will wait for your writing. Vataja Yoni Vyapad, that is V. Vataja Yoni Vyapad. And the cause is Vata Kara, Ahara and Vihar. And the medicines that are available today. Vataja Yoni Vyapad, you can write down the Maha Yogaraj Gugulu. Gugulu is the best medicine for Vata. And second analgesic is Maha Vat Vidvamsanaras. Maha Vat Vidvams. Because these tablets are easily available. whatever the mentioned by Charak, they may not be available easily. So this Yogaraj Gugulu you can give. Then Asava and Arishta, you can write down the two names. Dashamularishta for Vataja Yoni Vyapad, and Deva Darvyadi Kadha. Deva Darvyadi Kadha available in the market. Vataja Yoni Vyapad, we are talking Vataja. First, Rasayana treatment is a Chavanaprash. Pathya, the patient should use the wheat, mutton soup, and medicated milk. In Vataja Yoni Vyapad, you must give the Matra Basti. 60 ml Anuvasana Basti. Very little Matra Basti. And also sometimes Niruha Basti with Dashamula decoction. Next, Pittaja Yoni Vyapad. Pittaja Yoni Vyapad. The main reason that the lady is eating all the time very Pitta Prakopak Ahar and Vihar. Pitta Prakopa, spicy, pungent, working near the furnace, heat and heat, burning. So now I am telling you the internal medicine with the latest available medicines. You can prescribe Shatavari Ghrita, medicated ghee, Shatavari Ghrita, Dadima Ghrita, for Pittaja Yoni Vyapad, Dadima Ghrita. Then Ashoka Churna, Bhui Kohala Churna, Pittaja Yoni Vyapad, Pittaja, P, Pravala Bhasma, Suvarna Makshika Bhasma, in tablet, Pittaja Yoni Vyapad, Pittaja, Chandra Kalaras, Thanda, cool. Chandra Kalaras is the name of the tablet. Suta Shekhar tablet and Kama Dudha tablet. Then you can use Pittaja Yoni Vyapad, Ashokarishta. In Pittaja Yoni Vyapad, Rasayan is a Chavanprash. Pittaja Yoni Vyapad, patient should not take spicy, pungent food and avoid Pitta Prakopak Ahar Vihar. Third, Kafaja Yoni Vyapad, Kafaja, KK. Nidan, patient is taking Kafakar Ahar and Vihar, Kafakar, especially Abhishandi. Write down Abhishandi. That is fermented product. Kafaja Yoni Vyapad, Abhishandi Ahar, for example, curd, dahi, masale dosa, uttappa, dhokla. All the South Indian dishes are fermented products. That is the cause of Kafaja Yoni Vyapad. So internally you can use tablet Arogyavardhini, Kafaja Yoni Vyapad, Arogyavardhini, Chandra Prabha, Kafaja Yoni Vyapad, Laghu Malini Vasant, Kafaja Yoni Vyapad, Jasada Bhasma, Kafaja Yoni Vyapad, Lodhra Sav, Kafaja Yoni Vyapad, Puga Pak. I have the video checklist Ayurvedic medicine. You will get the video. Puga Pak, Suvarna Malini Vasant. I have already all these videos of the Ayurvedic medicines. Suvarna Malini Vasant, Pushchanuga Churna, and Pippali Rasayana. Naturally, Kafaja Yoni Vyapad, avoid the Pitta Prakopak Ahar and Vihar. Next, Sannipatika Yoni Vyapad, all the three dosha problem. Here, according to the dosha, you have to give the treatment, but you can do the Tagaradi Taila Pichu, swab. Tagara is an analgesic. Yoni Dhavana you can do. For example, medicated milk, Rasna, Gokharu and Vasa. Rasna, Gokharu, Gokshur and Vasa, Siddha milk for the Sannipatik Yoni Vyapad. And Parishekshan, vaginal douche with Aragvadhadi Kwat. Aragvadadi Kvat. 3, 4 finish. Yoni Vyapad. 5th, Asruja. Asruja. What is the cause? Rakta and Pittavardhak Ahar and Vihar. Rakta and Pittavardhak Ahar and Vihar. And there will be excessive menstrual bleeding with Sadah. Okay? What you can give, the present day you can give, you can use the Mahatiktaka Ghrita and Shatavari Ghrita. Shatavari Ghrita. Please write down Pushyanuga Churna. We are discussing Asruja Yoni Vyapad, Asruja Yoni Vyapad, Pushyanuk Churna, Asruja Yoni Vyapad, Avipattikara Churna. Sir, why you are repeatedly saying Asruja Yoni Vyapad? Because you are writing, no? I am giving dictation. Asruja Yoni Vyapad, medicines. It is related with the Pitta, Rakta. So tablets are Chandrakala Rasa. Asruja Yoni Vyapad, Chandrakala Rasa, Bola Baddha Rasa, Bola Baddha Rasa, and Bola Parpati also. In Bhasma, Asruja Yoni Vyapad, Suvarna Makshika Bhasma, Pravala Bhasma, and Vanga Bhasma. Rasayana, to stop the bleeding, Vasavaleh. Vasavaleh. Asruja Yoni Vyapad, avoid Pitta, Prakopak, Ahar, Vihar, and Atapa Sevan. 6th, Arajaska Yoni Vyapad. Arajaska Yoni Vyapad, VP, Vata Pitta is there. Vata Pitta is there. And the most important is irregular menstrual cycle and Anartava. Arajaska. No Raja, no Raja. Huh? So amenorrhea may be there. So what you can do? Swab is there. Shatadhauta Pichu. You can give the Uttarabasti with Shatavari Ghrita. Uttarabasti for what? Arajaska Yoni Vyapada. Internally, you can use the Falak Ghrita in the morning, 2 teaspoons. Falak Ghrita. In the Bhasma, Swarna Makshik Bhasma, Loha Bhasma, Abrak Bhasma, Raupya Bhasma with milk and sugar. Mauktika Bhasma. Then you can use the tablet Sutta Shekhar, tablet Kamadudha, tablet Chandra Kalaras, tablet Chandra Prabhavati. We are talking about Arajaska. Then we can use the Vasavaleh, Amalaki, Shatavari, Chavanaprash, Chandra Prabhavati. And basically you have to avoid the Ushna Tikshna Ahara Vihar. Next, 7th, Acharana Yoni Vyapad. Acharana. Acharana, naturally, uncleanliness, unhygienic case. And what will happen? There will be Shvetastrava, leukorrhea. Write down, leukorrhea. What you have to do? Shodhan with Virechan, with Nishottara Leha. Then you can do the Yoni Dhavana with Aragvadadi Kashaya or Trifala Kvatha. Then internally, in the Acharana, when there is no cleanliness, you can use the Kleda Nashaka Dravyas, Kleda Nashana. For example, Arogyavardhini tablet, Chandra Prabha tablet, Ayurvedic antibiotic. I always call them as a Ayurvedic Jod Goli, twins, Ayurvedic antibiotic, Sukshma Trifala and Gandhak Rasayan. Sukshma Trifala and Gandhak Rasayan. Because whenever there is uncleanliness, naturally bacterial infection will be there. Infection possibilities. You can use the Pushyanuga Churna, then Trivanga Bhasma. This is a very special Vanga, Trivanga Bhasma is very Naga, Vanga and Jasada. They are the best Kledanashana. Please write down. Best Kledanashana, Trivanga Bhasma. Then also to give the nourishment, Kushmanda Valeha can be used. And basically, the patient should maintain the cleanliness, and abhishandi ahar, fermented products, should be stopped. 8. Yoni Vyapad Aticharana, excessive intercourse. Excessive intercourse. Naturally, there will be dyspareunia, itching will be there, weakness will be there. So, what is the treatment? Aticharana? Medicated milk. Medicated milk with the Shatavari, Ashwagandha, and Vidarigandha. Then you can use the Bhasma, Abrak Bhasma, and the Trivandha Bhasma. Ghruta, for the Aticharana, you can use the Shatavari Ghruta, which is giving the nutrition to the lady, Shatavari Ghruta. Because Shatavari Ghruta is very specific for the female reproductive system. Then you can give the Rasayana, for example, Brahma Rasayana or Makaradhvaja. And basically, at least the Pathya परहेज क्या रखना है आपको? कई दिनों तक आपको intercourse नहीं करना है. Until and unless you get the total relaxation from this problem. That is Aticharana, because of the excessive coitus. Next is a Prakacharana. That means the intercourse before the puberty. In the early ages, like 13, 14, 16, when the organs are not well developed. So that disturbs the Vata dosha, and basically severe pain will be there in the perigenital area. Okay, and then automatically Yoni Strumsa, Yoni Bheda will take place, and the treatment will be nourishment treatment will be there, pain relieving treatment will be there, like Shatapaki Taila Pichu. Swap, one has to control the Vedana. Pichu is most important. Then we can use the Uttarabasti, that is Jivaniya Dravya Siddha Taila. Then internally, we can use Yogaraja Gugulu for controlling the pain, Mahayogaraja Gugulu. You can also use the Raupya Bhasma. You can also use the Shatavari Ghrita, Chandra Prabhavati. All these medicines you can use for Prakacharana Yoni Vyapad. Of course, the intercourse should not be done till the maturity arrives or this problem has been sorted out. Okay, my dear friends, the next all the diseases that we have covered right now, that is Upapluta, then also we have covered the Paripluta, then we have covered the Udavarta, Suchimukhi, Antarmukhi, Karnini, Shushka Yoni Vyapad, Vamini Yoni Vyapad, Putragni Yoni Vyapad, and last is the Shandi Yoni Vyapad. Shandi and Mahayoni, that I would like to add because that may be missing. Shandi Yoni Vyapad. What is the cause? There is a Prakupita Vata, Bijasthita, that means in the ovum, there is a hormonal imbalance. I am talking about Shandi. And then, what is the problem? As a, what you can say, the female genital organs are not properly developed. Please write down Shandi. Shandi is like a astani, the lady is not having the proper development of secondary sex characters. Hormonal imbalance will be there, and the final result will be infertility. So Shandi, infertility. Shandi, infertility. To treat these cases, to rectify the hormonal imbalance, we can give the Uttarabasti with Falaghrita and Shatavari Ghrita. Please write down Falaghrita and Shatavari Ghrita. Internally, we can give the Rasayana Falaghrita. Then also medicated milk with, you can cook the milk with Masha, Bhuikola and Vidari. Internally, we always give the Vrishyavati. The name of the tablet is Vrishyavati and Madhu Malini Vasanta. Rasayana Dravyas or the jams are Kushmandapak, Kushmandakavaleh and Musari Pak. Kushmandapak, Kushmandakavaleh and Musari Pak. We are discussing Shandi because of the hormonal imbalance and not properly development of the genital organs, and there is an infertility. Last but not least is a Mahayoni Vyapad. Please write down last 2 minutes, and last Yoni Vyapad is a Mahayoni. What is the problem? Improper posture during the intercourse. Improper posture during the intercourse, Vata Prakop will be there. Vata Prakop. And then there will be Yoni dilatation, Vivruta, frequent urination, then lower abdominal pain, and Katishula will be there. Katishula, pelvic region pain will be there. Sometimes there will be prolapse of the uterus. Prolapse, that is the Mahayoni, prolapse of the uterus. Final result, infertility. So one has to do the mini surgery, or you can do the os tightening. Mahayoni, when there is a bhransha, os tightening, cervical os is little bit tighten. The surgeon will, gynecologist will do that job. And Abhyantara, we can give the medicines like Madhu Malini Vasanta, Falagrita, and Pugapak. So this is about the Mahayoni. So my dear friends, this is the end of today's lecture, and also this is the end of the Yoni Vyapad Chikitsa, but you have to revise all the things 100 times so that you will remember. Always make some notes based on my video, and then gradually you will be commanding which Yoni Vyapad, which dosha, and which Lakshana, and what type of the medicines. But usually you can understand Yoni Prakshalana, Yoni Pichu, Snehana Svedana, Uttarabasti, Chandraprabha, Falagruta, medicated ghee, Shatavari Gruta, all these simple names you have to remember all the time and try to write down whenever they are mentioned as per the Yoni Vyapad. Thank you very much. We will see you tomorrow with the lecture of the Balaroga. Take care, and I wish you all the best for your studies. Thank you.